Prostate cancer is one of the most common types of cancer in men. In 2010, there were over 200,000 new cases diagnosed. Early detection and the best treatment options are always key. Joining me to share information on prostate cancer and the latest technology is Dr. Stephen Sawrie with Gulf Coast Cancer Centers. Stephen, thanks for being here.
Thanks for having me.
Well, prostate cancer is probably exactly what it sounds like, cancer of the prostate.
That's right.
But what about the causes and the risk factors? Let's start there.
Well, we don't fully understand. Obviously, there's some genetics that we're still working out, and we hope to know more about that as we continue to unravel the genetics of prostate cancer. There's some data to suggest that a high-fat diet, believe it or not, is a risk factor, but really the main risk factor is just age. So it's one of those cancers that the longer you live, unfortunately, the higher the risk.
Mm-hmm. So at what age has this really become important for men?
Well, the American Cancer Society suggests that at age 40, men start being screened for prostate cancer and do that on an annual basis. Now, if you have a strong family history, you may want to talk to your family doctor about doing that earlier.
Okay. Well, are there any symptoms that people might see, feel? How would they know if there is an issue? Some people may want to put that off. I know nobody really likes to do things like that. So what might they be looking for?
First of all, screening tests are easy. Part of it is not entirely pleasant. We'll touch on that in a minute. But there really, unfortunately, are no symptoms unless it gets out of the prostate and moves to other places like bone, and that's a different situation entirely.
Okay. So what is the screening process?
The screening process, again, starting at age 40, if you have a normal family history, is first of all a blood test. It's called a PSA, and that's really the most sensitive, but also a rectal exam, which is very quick, and this is a yearly recommendation.
Okay, so really, so it's detected through the blood work and the exam as well?
Mm-hmm. And the combination of those two actually are better than either one of the tests alone.
Okay. Well, what about treatment and how serious? Is this something that proceeds quickly? Is it something that's slow? Tell us a little bit about different types maybe, or what treatment options.
Well, it's a good question. It's considered a slow-growing cancer, although there are some variants that are a bit more aggressive, and we know that once we get the actual biopsy and we have the pathologist look at it under the microscope. But once we know what we're dealing with, then there are really four options. Just observation is one, and that depends on the health of the patient and the age. But most people want to go ahead and pursue treatment. There's surgery. That's certainly a mainstay. And then there are two different types of radiation options that are equally curative. One is just external radiation alone, and the other is a prostate seed implant, where radioactive seeds are actually implanted in the prostate itself. And that's.
Well, I know you've been really involved in some of this latest technology and some of the research. Tell us a little bit about what's new out there, since this is something that a lot of people just don't feel real comfortable about. Sure. So it's better though, right?
It is, and the side effects continue to go down with radiation as an option. In fact, most men can go through treatment with very little in the way of symptoms. One of the latest technologies was image guidance, and that's where you take a snapshot or an x-ray really of the pelvis right before we set the patient up to make sure that the prostate is in the right position. But our latest technology actually follows the prostate during treatment while the beam is on, and that's called our Calypso technology. We're real excited about that.
So exactly how does that work?
Well, with Calypso, you actually have little beacons. They're about the size of a grain of rice. Usually 3 of them are implanted by the urologist, the surgeon, into the prostate itself. And then once we start treatment, while the beam is on, we have our Calypso technology that monitors the movement or the position really of those 3 beacons, such that if they move even a millimeter or 2 out of position, the treatment itself is stopped and the patient's repositioned. And so we're able to target better. Okay.
And what kind of results are coming from this, and what kind of feedback are you getting from patients?
The feedback has been excellent, and we've been very excited with our technology. It's been seamless thus far. And again, you know, the goal for us, and what I talk to patients about, is now, again, literally at the rate of 10 times a second, we're monitoring where your prostate is while the radiation's on. So the advantage to them is that, number one, we're going to continue to reduce the side effect profile, but number two, we want to make sure we don't miss.
Mm-hmm. Right. Well, what about side effects? Are there any side effects to that?
Well, there's really no side effects to the Calypso tracking. You don't feel it. The treatment itself, anytime you have radiation, you know, you might go to the bathroom more often. You may have a little bit of a painful urination because the bladder sits right next to the prostate. Right. But with our technology now, we're able to make sure that if the prostate moves and the bladder, for instance, moves into the field, we'll stop immediately and reposition the patient.
Mm-hmm. So what do you see as the next step in technology?
Well, there's several things out there. There's the possibility of reducing a 9-week treatment down to just 5 treatments, and this technology would allow us to do that when that becomes standard of care. It's being studied right now, and that's one of the really big things on the horizon right now.
Well, how have you been involved in the research component?
Well, during training, of course, we're involved in not only. I guess my involvement in our practice, let me say that, has been the research of the technology itself, and so I was very involved in researching how we could make our prostate program better at Gulf Coast Cancer Center. Okay,
great. So what do you think is just the #1 benefit to the patient of the Calypso?
Well, I'd have to say that there's 2, and they're tied. Number 1, we don't miss, and number 2, we have the potential to reduce the side effect profile even further.
Okay, well that makes it. Why do you think people it's something they prefer not to even address or get screened or deal with?
Well, obviously, there's a denial component, and some folks just don't go to the doctor. If you don't go to the doctor yearly, then you're not going to get screened. In fact, we actually, because of that, offer at our various clinics prostate cancer screening for that very reason, and multiple organizations do that. But I think it's just a factor of folks being healthy and not going to the doctor.
Okay. Well, so we should start at 40, and then that should be yearly, correct?
That's right.
Okay. Are there any groups of people, or let's go back to the risk factors and who's more susceptible, or is it just across the board?
Well, no, actually, and we don't understand this, but the incidence or the probability of being diagnosed with prostate cancer is a bit higher in African American men. And obviously strong family history. If you had a brother, a father, and a grandfather that all had prostate cancer around the age of 50, then you may not want to wait until 40 to get your initial screening, but that's something that you'd consult your primary care doctor about. Okay,
great. So if our viewers wanted to get more information about the Calypso system or about your practice, where would they find that information?
Well, of course, they can call us, and I think the number's on the bottom of the screen. We also have a website, and on the home page there's a link to Calypso information, and that is, our practice is Gulf Coast Cancer Center, so the website address is gccancercenter.com.
Very easy to remember. Well, great information, and Stephen, we appreciate you being here.
Well, thanks for having me.